Dr. Mathew Devine, the Medical Director for Accountable Health Partners and Highland Family Medicine, is back with us this morning. Doctor, good morning.
Good morning, Mark.
I want to talk about antibody testing specifically today, but first let's begin by talking about the types of tests that have been done up to this point.
Yeah, so I think the reminder is up to this point we've been doing nasopharyngeal swabs, or NP swabs, which are ran in a machine called a polymerase chain reaction, or a PCR machine. Those can detect those that are actively having COVID-19 symptoms or are infected with it. Now we're transitioning to antibody testing, which is majoritarily done by way of blood test or serologic testing, and that can tell if somebody has had the illness prior. So it usually can detect antibodies in the serum approximately 7 days or so after they clear the infection.
All right, and how is that information used specifically as it relates to antibodies?
Great question. So this is sort of that next phase in doing surveillance of our communities in regards to how many of us really did have COVID-19. As you know, some people have asymptomatic cases, some people have a very mild course. Very early on in the course, some people weren't able to be tested, and so this gives us an opportunity to know how many of us really had the infection, so that we can kind of make more of these decisions like Mr. Cuomo's doing in regards to opening back up businesses, schools, churches, etc.
All right, this week we've reported that we're getting a high number of false positives when it comes to some of these antibody testing kits that are out there. Let's dive into the drawbacks a little bit here in terms of trying to understand the information.
Right. So what's happened essentially is, because this is sort of a state of emergency, a lot of companies have created these tests, and some of these tests didn't have that time frame to be tested to look to see how sensitive and specific they are. This is sort of a math equation that we want to follow. There's essentially no test, Mark, that's 100% accurate all the time, but you want to have a test that's as close to 100% accurate when you're testing things like this, because this has to do with people's lives. So we're looking for tests that actually are as accurate as possible, and that's why the CDC and others are looking at which of those tests are the best that are out there.
And what's being done locally to this end, Doctor?
So locally, we're starting to do this blood testing next week through the medical center, and other areas will be starting to do this testing as well in the near future.
All right, that's our stopping off point this morning. So important, these antibody tests, and so important that they're accurate as well. As always, thank you for your time.
Great, thank you.